Welcome to the February 10th, we'll get started, I believe. Welcome to the February 10th Public Health Officials COVID Media Briefing. We have Dr. Kandola, the Chief Public Health Officer with us, as well as Dr. AnneMarie Pegg, the Territorial Medical Director. Again, thank you for joining in these virtual meeting times. I think for those who've been in this meeting, you know how it goes, but Drs. Kandola and Dr. Pegg will begin with some opening remarks, and then we'll open up the floor to questions from the media. I'll do my best to get to it in an orderly fashion, but we please ask that it'll be one initial question and then a follow-up if you have one. Please respect that so everybody can get to ask questions during the time that we have. Remember to put yourself on mute if you're not speaking. And after the briefing is over, if you have any follow-up questions, you can email me at Darren_P_Campbell@gov.nt.ca. And so with that, I will turn it over first to Dr. Kandola for her remarks. Thank you.
Thank you. Can you hear me?
Very well.
Okay. Good afternoon, and thank you for coming to this week's briefing. I'll start with a short update on our COVID-19 pandemic response. On February 3rd, I declared an outbreak at the N.W.T. mine. This is when 2 cases of COVID-19 were confirmed in mine workers. There have been now 6 lab-confirmed cases of COVID-19 at the mine. I know the declaration of this outbreak has people in our territory concerned. You may have family and friends who work there. You want them to be healthy and safe. I understand those concerns. They are real. But this outbreak and our response to it shows that our efforts to keep the people of the N.W.T. healthy and safe are strong. All of these cases were identified because mine medical staff were monitoring the health of workers, testing people when they developed symptoms, and subsequently testing all 330 employees and contractors at the site for COVID-19 after the outbreak was declared. This was in addition to routine testing of inbound and outbound workers. Public health officials have been working closely with De Beers, Canada since the first positive cases were confirmed, focusing on stopping the outbreak in its tracks and reducing risk. We are also working on a plan to reduce the number of people on the site. This involves working with 7 provinces to safely transport approximately 130 employees and contractors to their home provinces, and enabling 70 Northwest Territory workers to safely isolate in the Northwest Territories. About 130 people will remain at the mine site for care and maintenance. We are cautiously optimistic the situation at the mine has stabilized, but we must remain vigilant. We also continue to closely monitor the other current COVID outbreak in the N.W.T. that I declared at N.W.T. contractor-operated winter road work site, and that was on January 28. I want to assure people there is no identified risk to N.W.T. communities from either of these outbreaks. So one of the things that is crucial in our efforts to defeat COVID-19 is getting Northerners vaccinated. As of this morning, we reached over 12,833 people for first doses of Moderna vaccine, and 299 people are now fully vaccinated. As of this week, the N.W.T. has offered first doses of the vaccine to priority populations in all 33 communities. Second doses of the vaccine have been delivered to residents and staff at all long-term care facilities across the Northwest Territories. The reduced shipment of 4,700 doses have arrived and are scheduled last week. The fourth shipment, scheduled for delivery later this month, will also be impacted, and we are waiting to hear from the federal government on details of what that impact will be. Communities that have already received their first dose of the vaccine can expect second doses to arrive 28 to 42 days after their first dose. And the N.W.T will continue to deliver second doses to priority populations closer to the 42-day mark to maximize vaccine supply. Please make sure you keep up with the vaccine schedule, and you can find it at nthssa.ca/COVID-vaccine. I know there's still hesitancy among some people about getting vaccinated, but vaccination is the best evidence-based way to maximize your immunity to this disease without risking complications. In trials, the Moderna COVID-19 vaccine is over 92% efficacious starting between 14 days after the first dose and the second dose, meaning even residents with only one dose are building strong protection against the disease. So 14 days after the first dose and before the second dose, people have developed antibodies of up to 92% efficacy based on the Moderna trial. But your protection does not end right at the 28-day mark if you do not receive your second dose right on time. And we are following the National Advisory Committee on Immunization guidance for second doses as more evidence emerges. As soon as second doses are available to your priority group, you should book an appointment anytime after 28 days of receiving your first dose. You will not have to restart the vaccine series if your second dose is late, and some jurisdictions are delaying the second dose in order to maximize the number of residents benefiting from the first dose. So Northerners have sacrificed a lot over the past 11 months as we've fought COVID-19 hard. We've had to reduce or eliminate travel to see family and friends. We've had to change how we work and how we socialize. If we want to return to a world where COVID-19 is no longer a widespread threat, getting vaccinated is the way to make that happen. Keep thinking about my trip to Yellowknife last month, when myself and a team of healthcare professionals visited this Clicho community to administer the vaccine. Some people there were hesitant to take it, but we had leaders in the community like Chief Football step up and get vaccinated. Chief Charlie Football felt it was important to lead by example. He felt it was important to show the vaccine is safe and it's the best way to protect himself and others in his community from COVID-19. So let's follow Chief Football's shining example. Get vaccinated. Protect yourself from the virus. Protect your loved ones from the virus. Protect your community. If you have any questions about the vaccine, please visit our website at gov.nt.ca/COVID-19. During the pandemic, I often talked about the need to be kind and compassionate to one another during these challenging times. This is so important. And if we are divided and choose fear over kindness, if we choose shaming and blaming over compassion, people will not come forward to report COVID-19 symptoms or get tested. I mention this because I am hearing concerns raised by some of the dedicated staff at our isolation centers that they're not being treated kindly because of where they work. This is heartbreaking and not acceptable. Isolation center staff and all those supporting the pandemic efforts have important jobs protecting our territory. Without their hard work, we couldn't run the centers in our isolation hubs. And this is where people can choose to safely self-isolate. And if people can't safely self-isolate, it does put us all at risk. So we should be thanking our isolation center staff for the work they do and not be treating them unkindly. So please be the territory I know we are, and let's all get behind the dedicated staff who work in our isolation centers. We are stronger in our efforts to defeat this virus when we are united. Together we can defeat COVID-19. Thank you.
Thank you, Dr. Kandola, for those remarks. Now I'll turn it over to Dr. Pegg for her to deliver her remarks. Dr. Pegg?
Good afternoon, everyone. I just want to start by taking the opportunity to recognize the ongoing efforts that have been made by so many in the territory to keep us safe here in the N.W.T. We do recognize that this has been a sustained effort over a long time. We're coming up on a year now, and I want to take a quick moment to recognize everyone from staff in the healthcare system to the general public who have come together to address this significant and now long-standing event. The collective efforts of everyone here in the territories have kept our community safe, our health system protected, our resources from being overstretched, and this is something that we have seen in other jurisdictions. This response, nevertheless, is tiring. Things still aren't back to normal, and I really do just want to thank everyone for their continued diligence and ongoing efforts. We can't do this alone, and because of our collective efforts, we've really managed to keep each other safe. I think it's important that we recognize these positive things that we have going for us here in the territory while we continue our efforts to address COVID-19. And with that said, I can give a quick update on what we're doing now from an operational perspective and in the coming week or so. Our vaccination teams continue the rolling out of clinics in line with direction from the Office of the Chief Public Health Officer. Over the past 2 to 3 weeks, clinics have been running in a variety of regions, including in Yellowknife, focused on target populations. And as of this morning, there were still a few appointments left, but they were going fast. And we expect to be fully booked today for those priority clinics in Yellowknife. The NTHSSA website remains the best place for up-to-date info regarding vaccination clinics. In addition to the Yellowknife vaccination clinics, we have gone back for second doses in our long-term care facilities, which is a major milestone as it allows us to protect our most vulnerable residents, a key part of our strategy. This morning, we also updated the vaccination schedule to include 11 of our remote communities with dates of the second round of clinics that will be starting tomorrow and running through the end of next week. In these remote communities, anyone who missed their opportunity last time for a first dose will be given the chance at the second visit to receive a vaccine. Again, as was the case with the last round of clinics, we'll update the schedule online, but we'll also be working with local media, health centers, and notifications on various media, social and otherwise, in order to keep the public updated as dates are added. Opportunities for those in bigger centers, including Yellowknife, will also be added as our vaccine supply becomes more clear. Vaccine clinics, as Dr. Kandola mentioned, can be accessed through the NTHSSA website, nthssa.ca/en/COVID-vaccine. This is the place for the most up-to-date information regarding clinic dates and times. I can also give a small update on our operational response in support of those isolating related to the Gashakwe mine outbreak. There's a rapid response team assisting with testing at the isolation centers. We've increased staffing at the testing center in order to assist with those who will be receiving asymptomatic testing, and those who are symptomatic continue to be tested at the isolation site where they are staying. Yellowknife Public Health, with the support of 2 additional nurses, is also handling daily symptom checks. And I'd also like to echo the words of my colleagues that the work of the isolation center staff remains critically important to keeping us all safe. And I'd like to add my voice of support to those people who are performing this all-important job. Once again, we can't do this alone. We are working together, and it remains very, very heartwarming to see the collective efforts of the territory going forward to keep us all safe. Thank you.
Thank you, Dr. Pegg, for those, and Dr. Kandola for those remarks. I'll open up the floor to questions now. And first, Megan Brackenbury from Cabin Radio, do you have a question for either Dr. Kandola or Dr. Pegg?
Hi, yes. Everyone can hear me all right?
Loud and clear on my end.
Perfect. Thank you everyone for your time today. I would like to know, I'm not sure who this would go to, I assume both of you, but have any second dose appointments been canceled in the N.W.T so far without being immediately rescheduled?
I can answer that. We only just started scheduling second dose appointments. The first priority to receive the second dose was certainly our long-term care facilities, and all long-term care facilities have been visited now, and residents who wish to receive a second dose and along with staff have done so. And we're starting to schedule second dose in some of the communities that have already received a first dose. So no, doses have not been canceled. There is some concern that people have a card, and in some cases there was a date written on their vaccination card or a time that said a certain date or 4 weeks. And I'd just like to reiterate that while there may be a date or a time frame written on the card, there is very good evidence and good support and good recommendations from the National Advisory Council on Immunization that delaying that second dose up to 42 days actually doesn't count even as delaying it. That's well within the acceptable window to receive a second dose. So people shouldn't be too stressed out if their vaccination card has one date on it and they get their vaccine, their second dose a little bit later.
Megan, do you have a follow-up for either Dr. Pegg or Dr. Kandola?
Yeah, I also would like to know, so I know that obviously a second dose clinic scheduled in 11 communities, as you guys announced today. And it also said that those people in those communities can receive their first doses as well, if they didn't receive it the first time around, if any of that is making sense. I'm wondering if you guys have a plan yet for people who do receive their first doses at the second dose clinic about how and when and where they can receive their second dose.
So that's been worked into the very evolving and always updated plan by the vaccination teams that look at our vaccine supply, where doses have already been delivered, and how to organize for the second dose. So dose teams will be visiting. We have always been planning for multiple visits to various communities, not just first dose, second dose, and done. We have always planned on multiple visits, possibly 3, possibly 4, possibly more, depending on how we need to organize to get people vaccinated who wish to receive it. So that's worked into the plan.
Thank you, Dr. Pegg. Now I'll Mario from Radio Canada, do you have a question for either Dr. Kandola or Dr. Pegg, please?
Yes, I do. It's probably for Dr. Pegg. We don't really know, I guess, the details of how many people were vaccinated per communities. I'm sure you have these details. Do we expect for the second first doses, for the people who are going to be getting their first doses during these second doses clinics, do we
Mario,
expect?
You're cutting out there.
I'm sorry.
It might be
question, please? Yeah, I'll try to ask it again. Sorry, my connection, I guess. Yeah, basically, simple question. Do we expect a lot of first?
Mario is cutting out, so we'll try to get back to him maybe in 2 minutes.
I can actually hear him quite fine.
Bailey Morton. Yeah. Bailey Morton with My True North. Do you have a question for either Dr. Kandola or Dr. Pegg, please?
Yeah, I don't know if this is gonna be the same question Mario was trying to ask, but how come you were able to add the extra dates for the 11 communities, even though you don't know the size of the 4th shipment of vaccines yet. You don't know how big the shipment is going to be.
I can start with this, and perhaps Dr. Kandola will have something to add. So we know that there's likely going to be an impact on the size of subsequent shipments, but we do know that those shipments are being received and we are going to get vaccine. And so what the vaccination teams are working on, and this has been the plan since the beginning, has been at the end of each clinic day, looking at the number of doses available and planning forward. And based on that forward planning, we have been confident that we can roll out the vaccination clinics as we have for the 11 communities that are now scheduled. And then again, based on arrival of subsequent shipments and vaccine that we have left, planning for the next wave of clinics will be planned. But right now, with the supply that we are currently aware of, we're able to keep planning those clinics that we have.
Yes, Bailey, do you have a follow-up question for Dr. Ken? Follow-up question?
Yeah, it's kind of it's on a different note. You said there were 130 people who remain at Gachagua to keep it operational. That seems like a lot of people that are still at the mine, considering they're trying to manage an outbreak. Is it the mine's decision how many people were to stay at the mine, or does the N.W.T have any input about how to best manage the COVID outbreak?
I can take that question on. Can you hear me, Bailey?
Yeah, I can hear you.
Yeah. So with this particular mine outbreak, my staff have been working closely with GK, and everyone in the mine had received one set of tests, and then they're going to be receiving a second set of tests. It was a mutual decision to reduce the mine just to care and maintenance for now, and to repatriate the southern workers back to their jurisdictions, and repatriate our N.W.T residents here in Yellowknife, along with high-risk contacts. We feel by reducing the mine by 2/3 of its capacity, and given the size of the mine, that they can safely continue to do their care and maintenance. But we are requiring rigorous testing and follow-up of the people at that mine site. For the workers from N.W.T who are isolated in Yellowknife, once they're finished, once they're later in their isolation and they're not judged to be a risk, we are going to offer vaccination for that particular crew. It was our last rotational workers at mines that we were scheduled to vaccinate this week, but unfortunately the outbreak preempted that. So we are going to, when we reintroduce or scale back GK to full capacity once this outbreak has resolved, we are going to ensure that our N.W.T workers are vaccinated, and there'll be additional surveillance tools available at the GK to make sure that we can monitor this and pick this up a lot quicker and reduce the spread for workers while they're at the mine site.
Thank you, Dr. Kandola. It was on my end, there was technical difficulties when Mario was asking his question, I understand. So Mario, we'll get back to you. And do you have questions for Dr. Pegg or Dr. Kandola?
Yeah, like I was saying, probably for Dr. Pegg. So simply put, like how many first doses do you or will you be able to give during these second doses clinics in the community? Like, do you expect large numbers in each communities?
I can't really comment on the numbers of people that we're expecting, but what I can say is based on the modeling and vaccine use and vaccine availability that we have, is that we're able to offer the second dose as well as a first dose to those who are interested in receiving one as we pass through the communities where the clinics are already, the dates have already been identified. So that's as far ahead as we're able to plan at this point. But the big objective for the teams has certainly been to vaccinate as many people as we can and who want to be vaccinated while not wasting doses or overbooking. And so the way the teams have sorted out the planning right now is that those second doses can be delivered to those who received a first with enough doses to offer first doses to those who want.
If anything happens, just I'll give you the phone.
I could add to that message, Bailey. We are expected to hear news about February 22nd shipment. Once we know the allocation and the amount, we can provide an update. But for the communities that we've rolled out, we have dedicated enough vaccines to provide immunizations to all those communities, both first and second. When we know the allocation of the fourth shipment, we can update our schedule accordingly. But that update is not far off, and we will be able to schedule the clinics based on the allocation amount. But we will be receiving doses on the week of February 22nd, which is not that far from here, about 2 weeks from now. So it's just finding out the number of doses receiving it, and that helps us schedule further communities in terms of second dose and add in a first dose.
Thank you, Dr. Kandola. Mario, a follow-up?
Yeah, maybe to follow up, I guess I'm just looking for a sense of, we know you've been to these communities the first time, and I'm sure some people wanted to get vaccinated, some people weren't sure. Like for the second time going around, of course, we know how many people were vaccinated the first time. Like, do you expect larger number than like more people, like a lot more people will want to be vaccinated this time around? Or I'm kind of asking the same question, I know, but I'm just trying to get a better sense of if a lot of people will want their first dose this time around.
There's a lot more communication materials that we've had made available. We have vaccine information sheets available in the languages. Initially, when we rolled down to the first week to Canada communities, they were the first communities, and there was some vaccine hesitancy going. We don't want to be the first, and as more and more communities became vaccinated, as more leaders, community leaders, mayors, chiefs, myself, as we got vaccinated, we noticed that in those particular communities where there was an increased uptake in vaccination. Now that we have over 13,000 vaccines in our belt, and with our ongoing communication plans, we anticipate that there will be a greater interest in first dose uptake. What I know personally, because my staff who are looking at the questions coming in at cpho and gov.nt.ca email, is a lot of the community leaders are reaching out to us and we're asking when the second dose was scheduled. So there's already a sense of anticipation and enthusiasm for those who got the first dose for the second. So I anticipate that we'll probably get a lot more uptake.
Thank you, Dr. Kandola. Next, Simon Whitehouse from Northern News Services. Do you have a question for either Dr. Pegg or Dr. Kandola?
Hi, Dr. Kandola. Can you hear me okay? Does this come through okay?
Yep, I can hear you, Simon.
One question I had was, I don't know, some major health agencies have already been advocating double masking. Do you have any thoughts on that? Or do we need like a regular mask and surgical mask, do you think?
I think what we need to be, we're looking to the Public Health Agency of Canada for guidance, and what works is having a 3-layer mask, 2 layers of cotton, and having a filler made of polypropylene or like made with coffee filter or some kind of absorbent material that can take on additional efficiency in removing small particles. A 3-layer mask would be what we've recommended based on the new Public Health Agency of Canada guidelines and what we continue to recommend. But most important of all is having a 3-layer mask is no use if you're not wearing it. So upgrade your mask to the 3-layer mask that we have on our website and wear it in all public spaces. I think this is more related to the concerns around the variants of concern and their increased infectiousness and stickiness that people have been making these recommendations around upgrading masks out of abundance of caution. And for myself is if you can put in that filler in your 2-layer mask where it has the insert, that would really improve efficiency.
Simon, either follow-up question for either Dr. Kandola or Dr. Pegg?
Sure, thanks. And maybe I didn't catch it, but I'm just with the Gachagua outbreak, Dr. Kandola. I've heard like maybe the Dene Nation is a little bit concerned about what this might mean for its members. Could you maybe just make a statement to maybe sort of alleviate some of their concerns about the possible threat that it might mean to their communities and members?
No, I understand. So one of the we have to realize we have 330 minors. We have 6 confirmed cases. 2 of those, one of those cases has recovered, and another one will recover by this weekend. 2 of those remaining cases are N.W.T residents, and 2 are not N.W.T residents. They are doing well. They're not requiring any further medical intervention or hospitalization, but they are isolating well. And the best thing we can do in a mine situation where we have a closed camp and people there 24/7 in a congregate setting far away from medical facilities is to test everyone, make sure people are isolated, but try to thin out that camp, have people who are not close contacts repatriate back to their home communities and finish their isolation out there. Continue to keep a very small crew to maintain care and maintenance. And everyone else, we're recommending rigorous testing, and everyone is going for the 14-day self-isolation. These are very rigorous measures. It's to break the chains of transmission. We have to also realize that the entire mine has been tested once and they're undergoing a second test, and we're waiting on those results. Since Saturday, they've all been isolated, so today would be their 5th day, and we're testing them on a regular basis. And the ones that who do have who are active cases, they are doing well. But this is to prevent, to bring them into facilities where they're closer to healthcare, or to repatriate them at home where they can isolate safely at home. This is the best way to diminish and limit the spread of this outbreak and break all chains of transmission. So we're doing everything that we can safely do to prevent this from spreading further. But our longer term goals are to make sure that every N.W.T worker who works in the mine is offered a vaccine, to continue the inbound, outbound testing, to continue the rigorous measures they have in place. They also have point-of-care testing on site to test symptomatic people. And in addition, they're going to be doing some exploration on enhanced wastewater surveillance at site. That way they can have a really good assessment to see if anything's circling between people coming in, testing negative, and before they leave. So there are going to be enhanced measures. The mine took this outbreak quite seriously, and they immediately shut down routine operations and went into care and maintenance mode. So I am confident that we will have a good, strong control over this outbreak and have enhanced measures in place to prevent future outbreaks.
Thank you, Dr. Kandola. Marie from Laquillon, you have a question for either Dr. Kandola or Dr. Pegg?
Yes, I do. The Northwest Territories, well, it's probably going to be Dr. Kandola. The Northwest Territories Teachers Association requested on multiple occasions that the teachers should be considered as essential worker. Will you add the teachers to this list before the spring break?
Is that question directed to myself? I accidentally pressed leave instead of mute, so I'm back.
Did you hear the question?
Can you repeat the question?
Yeah, please repeat it, Marie.
Yeah.
Thank you.
So the Northwest Territories Teachers Association requested on multiple occasions that the teachers should be considered as essential workers. Will you add the teacher to this list before the spring break?
So one of the, when we look at vaccines and vaccines eligibility, we're focused on the priority populations where we know they're at increased risk of severity. So we know that age is a definite the strongest severity risk is the older you are, the higher risk you have for complications if you develop COVID. So 16 and older, everyone's been offered the vaccine for people 16 and older, and that includes teachers. For people with chronic diseases, that's also offered across N.W.T, that chronic diseases with a priority population where we've offered the vaccine. The one scenario, the one vulnerable population that is not eligible for the vaccine are children under the age of 18. And in some of those scenarios, we have vulnerable children with chronic conditions who are going to school. In the elementary school grades, we do not do physical distancing. We have allowed, because of the, we've allowed classes to not need to be 1 meter separated, such as middle school, or 2 meters separated, such as high school. The classrooms themselves are a bubble. And this enhanced type of congregate setting makes it high risk if someone was to come back from out of territory, travel, and come right back into that setting, because it is a bubble community. So the balance is, if the schools wanted to be able to continue their classes and have no physical distance in the elementary schools and a minimum in the middle schools. So to create that type of bubble, we have to make sure that there is no risk of introduction of COVID in that setting. Because they're not eligible for the vaccine, it makes them that much more at risk. The difficulty of having teachers go back to school when they've traveled out of territory on day one is that it introduces a risk in a very unprotected setting. And so that has to be taken into consideration. And at this point, teachers will still have to isolate for 14 days after they've traveled out of territory, just to protect the children.
Thank you, Dr. Kandola. Marie, do you have a follow-up question for either Dr. Pegg or Dr. Kandola?
It's just something I would like to verify on the government websites, like the data and statistics, the COVID-19 dashboard. We can see that there are currently 7 active cases in Northwest Territories. And when we look at the data in the health region, it seems like 1 is still active in Yellowknife, and I wanted to have an update in that regard.
So thank you. We have two of our we have 2 active cases in the Gachagua mine that are N.W.T residents. So they would be the 2 active cases. This we had a case in Fort Liard, but that is now recovered, so that would no longer be considered active. So this dashboard gets updated once a day, and so we need to add 2 active cases in N.W.T. because we also have confirmed a second N.W.T. resident from the Gachikwe mine that has had COVID-19. This one that you see that's active right now is the one that is currently in isolation here in Yellowknife.
And he was coming from the mine.
We have yes, those that would represent the N.W.T. resident isolated in Yellowknife who was positive from the mine. We had one in Fort Liard, like I said, that has recovered and would no longer be considered positive. This website also needs to be updated because we have an additional active case in an N.W.T. resident that went out in the public health advisory. So we will update this. It'll be updated to reflect more active cases in N.W.T. When you see the 5 non-N.W.T. residents that are active, these reflect out of territory workers who are positive.
Thank you, Dr. Kandola. Paul Bickford, are you in on this call?
Can you hear me?
Is that Paul?
Yes.
Okay. Yeah,
Can you
we
hear me
can
okay?
hear you. Yeah, can hear you okay. Do you have a question for either Dr. Pegg or Dr. Kandola?
Yes, I do. Dr. Kandola, I believe you said earlier that there's been 12,000, if I heard you correctly, 12,000 vaccinations so far up till this morning. I'm just wondering, have you heard of any negative allergic reactions, any poor reactions by people getting the vaccinations here in the N.W.T?
So yeah, so we've had 12,833 dose 1 vaccines and 299 dose 2 vaccines. There are common reactions that people get, such as local redness, pain, swelling at the site, and there's this phenomena that they call the COVID arm, where they get more swelling, which disappears by itself. It's a common phenomena that they're seeing with Moderna. Other common side effects are headaches, feeling chilly, feverish, having muscle or joint pain, feeling extremely tired. The adverse effects that you're talking about are allergic reactions, and we have had a few of those allergic reactions that are more than just common side effects. All those adverse reactions come to us for review, but when you look at the amount of vaccines we've given, and we've given over 13,000, including first and second doses, they're relatively smaller, a small amount in terms of really serious allergic reactions. And then there are other adverse reactions that we have to report that may not be linked to the vaccine. So this is being reviewed by my staff, and once we finish the vaccine rollout, we can synthesize all these adverse reactions. But right now, it's just being reviewed, evaluated, and reported back to the primary care provider and to the Public Health Agency of Canada, and back to the client, whether this is a serious enough adverse reaction to warrant not getting the second dose.
Paul, follow up for either Dr. Kandola or Dr. Pegg?
No, that's good. Thank you.
Okay, thanks, Paul. Is Mark Winkler from CBC North on the line? I'm just seeing a few phone numbers here, so don't know who's who. Doesn't sound like it. Oh,
hello?
That Mark?
Yeah. Hi.
Yeah. can hear you. It's you're a bit low, but if you can turn the volume up.
Okay. All right. I have a question. I was going to ask about COVID arm and whether that was a concern, but I'll just follow up on the last question, I guess. If people won't, if it looks like people shouldn't get the second dose, what sort of options are open for them, or what happens then?
The one of the it depending on if if they're not eligible for the second dose, and the first dose does provide high efficacy, but if they're a vulnerable person, if they're like over 60 or they have chronic disease and they want to, they're concerned about the severity if they do get COVID. We don't know how long the first dose can protect, but part of the assessment is we could also consult an allergist, because the mRNA is not the only COVID vaccine available. It uses a particular platform, but there are other vaccines that can come that are emerging and getting approved shortly that have different vaccine platforms that they may not be allergic to. It depends on what their adverse reaction was, and also it depends on what the allergist would say, and whether we can consider boosting with a second dose from a different COVID-19 vaccine with a different platform. However, like I said, the first dose does provide significant protection after day 14. We just don't know how long it lasts and the optimal timing for a second dose booster.
Thank you, Dr. Kandola.
Okay.
Mark, a follow-up?
Yes, I don't know if I heard it in your last response there, but did you say you had numbers on how many people did have allergic reactions in the Northwest Territories?
Some of the serious allergic reactions, it will be less than 5. We haven't had many. It's just we have a lot of adverse reaction reports that we're assessing. Sometimes it's not linked to the vaccine, but it's within the same time frame. So we're trying to, my staff are trying to work through those. But for very serious life-threatening allergic reactions, it's been quite a few. In N.W.T, like I said, we've administered over 13,000 vaccines. One of the ways to get, it's a small territory, but one of the ways to get a better assessment at with a larger number is to look at the Public Health Agency of Canada, where there's been over 1 million Moderna vaccines administered, and then they're tallying the adverse reactions for that, because that would have the large enough numbers to give you a sense if Moderna is having higher allergic reactions than other vaccines. And then also CDC, we're looking particularly at the Pfizer vaccines in terms of allergic responses in the Moderna. So these are other sources of information that have bigger numbers to provide you the sense whether Moderna is generating higher allergic reactions than other vaccines. And I believe with the Public Health Agency of Canada, they did not feel it did, but that's available on the website.
Thank you.
Thank you, Dr. Kandola. Is Maria Caruso at CKLB on the line? Or anyone with Radio Taiga?
Well, I am with Radio Taiga just as well as it's Mikey also. Well, I can ask a question if you want to.
Thanks, Marie. Yeah, we're at the over the hour time limit, but yeah, I see we are over the time limit a bit. But thank everyone for joining. I thank Drs. Kandola and Dr. Pegg for taking the time in their busy schedules to take part in this public health officials briefing. Again, if you have any follow-up questions, email me at Darren_P_Campbell@gov.nt.ca. And thank you very much for your time. This is the end of the brief. Thank you.
Thank you.
Thank you.